Okay, welcome everybody. Thank you very much for attending today. أهلا وسهلا فيكم. My name is Nahla Rifai and I'm the CARE Jordan Head of Advocacy and Communications. We'd like to welcome you today to the launch of the 10th Annual Needs Assessment for CARE International in Jordan. Just a few housekeeping rules. For anyone who'd like to ask questions to any of our panelists, please feel free to do so through the Q&A link at the bottom of your Zoom. For any other issues, please feel free to also send us any comments through the Q&A. Today we have with us His Excellency Mr. Bernard Lynch, the Australian Ambassador to Jordan. Your Excellency, it is an honor for us to have you with us. The floor is yours.
Thank you very much, Nahla, and thank you all for joining this important occasion today. I'm very pleased to join you today to launch CARE's 2021 Annual Needs Assessment of the most vulnerable populations in Jordan. Now in its 10th year, this is an important mechanism for tracking the needs, vulnerabilities, and coping mechanisms among refugees and host communities over time. I would like to start by thanking the many households who gave their time and shared their insights to inform the study. Thanks also to the team at CARE for your diligent work in compiling this report. I want to recognise at the outset the commitment among a broad range of actors to delivering high-quality assistance to the most vulnerable populations in Jordan. The government of Jordan has shown tremendous leadership and generosity in hosting Syrian, Palestinian, Iraqi, and other refugees from across the region and providing quality services to vulnerable Jordanians. Local partners continue to play an instrumental role in delivering services across Jordan that are appropriate to the context and promote sustainability. And the international community, including Australia, continues to support these efforts to ensure refugees and Jordanians alike are able to live with hope and dignity. Working together, we have supported over 150,000 refugee children to access quality education. Many Syrians have had access to work permits and economic opportunities and built their self-reliance. There have been many factors and many actors which have contributed to the successes in Jordan. One of these is the consistent efforts that partners like CARE have put into listening to the voices of the most vulnerable populations in Jordan and encouraging all actors to respond to these voices through our policies and our programs. COVID and its restrictions have made listening and seeking views more challenging, but arguably more important than ever. I'll leave it to Ammar and Julia to elaborate on the findings and recommendations of the report. Today, I'll focus my remarks on why this work is important. Listening and being accountable to those we seek to assist is at the centre of good humanitarian and development approaches, and indeed to good governance. This assessment plays an important role in that listening exercise, bringing together a broad cross-section of views so we can better understand the needs and vulnerabilities and how these have changed over time. But we know that gathering information is just the first step. As partners in Jordan, we need to take this report and apply it in 4 main areas, consistent with the Interagency Standing Committee's guidance. Firstly, demonstrating leadership by integrating participatory approaches in humanitarian and development program cycles and strategic planning processes from country level down to individual projects. This involves establishing appropriate management systems to solicit, hear, and act upon the voices and priorities of affected people in a coordinated manner. Second, promoting meaningful participation of refugees and refugee-led organizations in decision-making, including organizations led by women and people living with disabilities, is an essential element of a whole of society response to refugee crises and to successful implementation of the Global Compact on Refugees, to which Australia committed in 2018. At the Global Refugee Forum in December 2019, Australia supported, together with Denmark, Canada, and the Netherlands, a joint pledge on the meaningful participation of refugees and host communities in decisions that affect their lives. Supporting meaningful participation aligns with the localization agenda. We aim to engage refugees and refugee-led groups in program design and implementation with proactive support for women refugee leaders and persons with a disability. This ensures that affected people have the power to influence the aid they are receiving, acknowledging they are the best place to identify those most at risk of harm and to determine the most effective protection response. Third, the communication loop of seeking information, providing feedback, and taking action in response is essential to building trust and improving policies and programs. Whether it be addressing risks and safeguards or adapting programs, this is central to accountability. Finally, we should measure our results against these actions at an organizational level and collectively, including through the core humanitarian standard. By taking these actions, we can be confident we are making the most of valuable reports such as this annual assessment. Australia is pleased to be working alongside many of you online today to help meet the needs of the most vulnerable communities in Jordan. Our ongoing partnership with CARE has been a productive and rewarding one for many years, and we are pleased to have supported this assessment. I'm delighted to announce that we have a new Australian humanitarian partnership program coming online in Jordan, led by an outstanding NGO consortium, which includes CARE. Through this program, we will work with our partners to address some of the education, livelihoods, and protection challenges highlighted in the annual assessment. The program will have strong focus on accountability to affected populations, promoting local leadership, supporting gender equality and women's empowerment, and promoting rights and opportunities for people living with disabilities. These themes anchor Australia's engagement in Jordan and globally, and we look forward to this new collaboration. Australia's support for the education system in Jordan continues, and we are proud to be a partner of the Ministry of Education's Accelerating Access Initiative. This school year marks the first in which all refugee children, regardless of origin, are able to enroll in Jordan's public education system, and we commend the ministry on its adoption of this one refugee approach. Australia continues to support initiatives to increase economic self-reliance for refugees and Jordanians alike, recognizing the severe economic impacts of COVID-19 on many. And for the most vulnerable, we continue to support social protection measures, including cash assistance. My thanks again to CARE. I will now hand back to you, Nahla, so we can hear about the report's findings and recommendations. Thank you.
Thank you very much, Your Excellency. That was a very empowering message. And thank you very much for your continuous humanitarian support to those who are most vulnerable in Jordan. I now would like to hand over the floor to Mr. Ammar Abu Zayyad, the Country Director of CARE Jordan. Ammar, the floor is yours.
For the launch today, and also for the support from the Australian work that CARE and other organizations are doing in Jordan to respond in the best way possible to the crisis we face. It's really an honor to have you with us and an honor to have all guests and colleagues who are joining us over Zoom today as well. Even though this is the 10th assessment that CARE is conducting, I can't help but compare it to last year's assessment. Last year was an assessment done in the midst of the pandemic with a lot of uncertainty around us, where we were making shifts in how we were doing the data collection remotely, trying to assess the impact of COVID at a time of a lot of uncertainty, and also having some dose of wishful thinking that some of these trends that we were picking up last year would be momentary and would not last for the long run. Unfortunately, with this year's assessment, the COVID storm is ongoing. The pandemic is now behind us, and the waves and variants are continuing to hit. And with that, the impact is becoming much clearer. And we have this sobering realization and situation to grapple with, as many of the initial findings from last year persist and are here to stay. And it's clear that we are facing a complex set of challenges with no quick fixes. The socioeconomic pressures are mounting and having a ripple effect that is leading to increased feelings of insecurity and resorting to negative coping mechanisms. And unfortunately, that has also translated into lost ground compared to achievements that we've had before the pandemic. The pandemic has increased the protection concerns that we have, alongside and including challenges in access to health, food, education, legal services, and then overall deterioration in mental health, living conditions, access to employment, and livelihood, amongst other areas. As Ambassador Lynch pointed out, Jordan has done exceptionally well over the past decade of hosting hundreds of thousands of refugees, mostly Syrians, but also others. And during the pandemic, that has continued. The Jordanian government has continued to balance the needs of refugees and the host community, and in a way that really deserves recognition and further support, as that commitment furthers the safety and protection for all in the kingdom. A notable example has been the equitable access to vaccination and other services that has really set an example for other countries to follow as well. So it's really, again, important here to thank the government of Jordan and commend its response and collaboration with different international actors. But even with all the efforts of the government of Jordan and the other actors and stakeholders in the country, the outlook is a difficult one. We continue to worry about the long-term implications of the pandemic, and on the socioeconomic fronts in particular, and how we can ensure that there are adequate plans in place, that no key issue is overlooked, and that we continue to work together and pursue collective impact on all fronts. And here I want to highlight three key issues that are very important as we think about response and moving forward. First is to consider the impact on the host community, as well as the presence of different refugee groups and migrants in Jordan. And here to continue to work on having and adopting a comprehensive vulnerability-based approach for the interest of all vulnerable Jordanians and all refugees, regardless of their nationality and origin. And this needs to be linked to the long-term resilience and development goals of the Jordanian government. The second point relates to the triple nexus. This year's research and assessment is really highlighting the importance of adding peace building and community cohesion to be part of the focus of our programs. This requires further buy-in and focus in our programming so that we address the humanitarian needs, but also the development needs, and the focus on that community cohesion and peace building at a time that there is a lot more strain on the different communities. We recognize there are no quick fixes, and we need to focus on the underlying causes of the issues we face. But we really believe that success is possible here against all odds and despite all the challenges faced. The third and perhaps most important point is to recognize where we've lost ground, to recognize where negative coping mechanisms have taken over, especially when it comes to child labor and early marriage, and in particular, to remain focused on the shadow pandemic of gender-based violence. This is a global trend that's present in Jordan as well, and it is crucial that more is done to enhance access to justice, address underreporting, and focus a lot more on the social norms and attitudes that contribute to this shadow pandemic's persistence. There is no vaccine for gender-based violence, and the urgency is just as high for us to proactively engage on this and reverse the current trends. So to sum up, I believe this is a very important time that we need to pursue a comprehensive approach to vulnerability, ensure women and girls come first, are protected, empowered, and always at the center of everything that we do, and that we pursue sustainable solutions and long-term development on all levels, including peace building. While the challenges are high, we are well positioned to come out of this stronger, to find opportunities in the crisis, rise above the challenges, and achieve meaningful and sustainable impact for Jordanian society and all its components, against all odds and despite the more challenging environment. We're really convinced that we can do it. We are in a key moment of needing to come together, work more closely together than ever before, and to rise above the pandemic and its effects. This means that we continue to work together, that we ensure we have common agendas, the necessary resources, and continued commitment to an inclusive, accountable, and equitable response to the benefit of the people that we are here to serve. Thank you.
Thank you very much, Ammar. That was a very comprehensive presentation and one that indeed stresses the importance of including gender and women and girls in all we do, as well as working together. Thank you very much, Ammar. I would like to now hand the floor to Ms. Julia Maria Angeli, our Head of Gender and Program Design. Julia, the floor is yours.
And special thanks to His Excellency and to Ammar for welcoming us today. And now I'd like to share some key findings from our annual needs assessment. The 2021 assessment is the 10th installment of a series that dates to 2012. The aim of the assessment is to identify, analyze, and track the needs, vulnerabilities, and coping mechanisms of refugees and host communities in Jordan. CARE Jordan conducts these annual assessments for the benefit of all humanitarian and development actors, with the objective of building a better response that addresses the needs of the most vulnerable populations in Jordan. Our methodology. Qualitative and quantitative findings have been analyzed and triangulated. The assessment followed a phased approach, with primary data collection informed by a secondary data review and the quantitative survey implemented after the qualitative methods. The annual assessment identifies changes over time using data from the previous 3 years. The data was collected between July to October 2021, and following a desk review, 12 key informant interviews were held, including 40 focus group discussions and a total of 2,674 individual cases participated in our quantitative survey. The areas that we looked at include Amman, Azraq Camp and Town, Irbid, Mafraq, and Zarqa, areas with the most dense population of refugees. We reached Syrian refugees, Iraqi refugees, refugees from other nationalities, including Yemeni, Somali, Sudanese, Jordanian host communities. Our themes include protection, livelihoods, education, durable solutions, with gender and COVID-19 cross-cutting issues. Our source of data is the CARE database, which now includes over 600,000 records of refugees and vulnerable Jordanians. So let's start with protection. The 2021 annual assessment indicates high rates of registration with UNHCR of refugees across nationalities. Almost all Syrian refugees are registered, followed closely by 96% of Sudanese, 96% of Yemenis, and 95% of Iraqis. The assessment has shown that at an aggregate level, 10% of respondents indicated they lack some form of documentation. However, for Iraqis, this is at 15%, and for Yemenis, this is at 16%. As you can see from the chart, there's been a significant decrease in the percentage of Syrians missing documentation since 2018. We found that 51% of those surveyed said that their first choice would be to receive cash. Participants in focus group discussions explained that they prefer cash because it is flexible and enables free choice. The second choice would be for food and non-food items at 32%. 61% would prefer to receive communications about services and assistance directly from organizations, and nearly half through WhatsApp or SMS, followed by 30% on social media. Our assessment has shown that insufficient transportation options for Jordanians and refugees impacts livelihoods and access to services. Compared to the previous year, slightly fewer respondents noted feeling negative emotions all or most of the time, demonstrating an improvement in mental health. Mental health, however, continues to be a key concern for older people who are often marginalized and excluded from society. Many focus group participants feel that humanitarian assistance is unfair and insufficient to protect both refugees and host communities in Jordan. Our assessment has shown that non-Syrian refugees feel forgotten by the humanitarian community, as they are not prioritized or documented as well as Syrians, and therefore do not receive systematic support. Importantly, refugees of African origin reported much higher rates of their own or their families experiencing harassment compared to Jordanian and Arab refugees. In addition, non-Syrian refugees, particularly those of African origin, report high rates of ongoing discrimination based on race, ethnicity, and refugee status. Over to some gender-based violence findings. Increase in GBV is one of the biggest concerns at this point in time for refugees. As shown in the bar chart, reasons for not feeling safe in the home changed during the last year, with an important increase in verbal and emotional violence, reflecting findings around the impact of COVID-19 on household tensions. Threats of evictions by the landlord remain the primary reason for feeling unsafe. The assessment has also shown that sexual harassment and sexual exploitation are a concern, especially among working women in both urban areas and Azraq camp. There is some evidence to suggest that the incidence of GBV may vary by nationality. For example, 27% of Iraqi respondents said that women and girls were at an increased risk of violence due to COVID-19, compared to 14% of Jordanian respondents. Deep-rooted structures, including social norms and values, as well as policies and services, continue to enable or perpetuate GBV and create barriers against tackling it. Over to vaccination. Gender shapes rates of COVID-19 vaccinations, with males more likely to be vaccinated than females. This gender gap reflects a global trend. The locations with the lowest vaccine rates were Irbid at 57%, Mafraq at 59%, compared to the highest in Azraq camp at 78%. Thanks to the inclusive and generous efforts of the government of Jordan, access to vaccines has been relatively strong, with 93% of all respondents indicating they did not face any challenges to receive the vaccine. Looking now at sustainable livelihoods. To start with some official statistics, the unemployment rate in the third quarter of 2021 stands at 23%. However, for 15 to 24-year-olds, this increases to 37%. According to our survey, 22% of Syrians have a work permit. This is the lowest rate within the last 2 years. Last year, COVID-19 restrictions were the most frequently cited barrier to employment. This year, it is a lack of knowledge on where to find opportunities. A really important finding here is that reliance on humanitarian cash assistance has increased since last year. 5% of respondents indicated that their secondary source of income was begging. This seems to be most likely for Iraqis and Sudanese, both at 16%, and Yemenis at 13%. Our assessment has shown that of those that are formally or informally employed, only 7% have a written contract and 12% have an oral contract. This year's assessment again shows how those working in the informal sector face extreme protection risks, including exploitation, long working hours, dangerous or unhealthy working conditions, and harassment. Shifting to women and livelihoods. Findings show many families are adapting to shifting roles and responsibilities. However, not all embrace these changes or see their benefits. Last year's survey showed that caring responsibilities increased for men and boys throughout the pandemic, and nearly half of this year's respondents agree that these continue to increase with the easing of lockdown. A total of 20% of respondents agreed somewhat or completely that women have increasingly become the income provider over the past year. However, several key informant interviews warn that work does not necessarily translate into empowerment. This is evidenced by the following findings. In 2021, 13%, that's over 1 out of 10 respondents, believe that it is shameful for the family when the woman has to work. Additionally, only 2.4% of respondents agree that women who work have control over the income they bring home. Jordanians continue to earn more than refugee communities. However, the average income level among Jordanians decreased since last year, even if by only a small proportion, while that of Syrians and other refugee communities increased. The table compares income levels across communities over the past 3 years. With regards to debt, our assessment has shown that 83% of female and male respondents have debt, with the highest rates among Sudanese at 96% and Somali 90%. Jordanian households have staggeringly, on average, more than doubled their debt over the course of last year, as is the case for other communities. Going to education. Our assessment shows that boys were more likely to drop out of education in order to work than girls. A stark finding is that the financial shock of COVID-19 has increased the use of child labor as a coping mechanism, resulting in an increase of children, especially boys, dropping out of school to work. Child labor was more common amongst Yemenis and Syrians. Our qualitative data shows that both tradition and financial instability are key motives for early child marriage, as demonstrated also in last year's assessment. Findings from the survey suggest that 32% of boys and 30% of girls are not attending school. Lack of money and transportation is one of the barriers for accessing education in both urban and camp settings. Accessibility barriers remain dominant for children with disabilities. 56% of boys and 54% of girls with disabilities were not attending school in 2021. In addition, bullying and harassment further contributes to reduced quality of education, with poorer and remote areas more at risk of lower quality education. Our assessment shows that accessing remote digital learning brought its own challenges. Limited internet and access to technology all contributed to access challenges for digital learning. The switch to digital learning during COVID-19 was associated with a decline in the education quality in comparison to in-person education. The vast majority of respondents believe that in-person learning over a blended or remote approach is best for their children. Our final thematic focus is durable solutions. The survey from the previous year found that the majority of respondents had a preference to remain in Jordan. Male and female respondents both had preference for this, with 64% and 72% respectively. As you can see in the chart, this year this has changed. In 2021, there is a general preference to resettle to a third country over returning home or remaining in Jordan, with 57% indicating their preference for this. Following resettlement, staying in Jordan was the second most preferred durable solution, with 39% of respondents indicating this. And only a small minority of respondents, 3%, stating that they wanted to return to their home country. Finally, preference for relocation was highest in Sudanese at 87%, Iraqi and Yemeni both at 72%. Perhaps this is reflecting our other protection findings on non-Syrian refugees. Now I would like to present a set of recommendations which will hopefully be useful for all the actors working in this field. To start, national policy reforms should adopt the one refugee approach by ensuring that all refugees in Jordan, particularly non-Syrian refugees, can access services and assistance based on vulnerability without consideration for origin. Adopt and enforce policies to address underreporting of SGBV, including through safe and confidential reporting mechanisms. Expand livelihood opportunities for refugees by expanding the variety of accessible work sectors. Promote women's economic empowerment and higher levels of participation in the economy through policies that lift barriers, provide incentives, and address harassment and abuse in public spaces and workplaces. Continue to improve the quality and accessibility of e-learning in Jordan, with particular focus on the most vulnerable children. To donors in the international community, we would like to recommend increased support for the Jordan Response Plan, particularly support that addresses the socio-economic impact of the COVID-19 pandemic. Prioritize the provision of financial assistance to facilitate access to education and address the increased number of students dropping out of school for work or early marriage. Fund NGOs, especially women-led and women rights organizations and refugee-led organizations, to address immediate basic needs and enhance long-term economic recovery. To national and international humanitarian and development actors, work on development programs tackling social norms that form the underlying causes of gender inequality and racial discrimination. Enhance and increase the inclusion of older people and people with disabilities in existing programs, and ensure programmatic support is appropriate and targeted based on specific needs. Continue to support small business grants and SME mentoring schemes that support entrepreneurs in adapting to COVID-19 pandemic requirements, particularly in migrating to online businesses. Finally, operationalize the humanitarian development nexus in the new way of working, so that humanitarian and development actors can work collaboratively together based on their comparative advantages. We would like to give thanks to our donors for their generous funding, which made this assessment possible. Thank you all for listening. I know it's quite a dense presentation, so please know that you'll receive the executive summary following this launch, which you can digest at your own pace.
Thank you very much, Julia. That was indeed a very comprehensive yet compact presentation of very important findings on gender inclusion and livelihoods, amongst others, that indeed all of us need to work on a local, national, as well as global level. Thank you very much, Julia. For our next section, we will be presenting you with a video called Voices from the Field, where we will have 3 of our program participants tell you themselves what they've been going through and give you a few messages about what they hope to see from the local as well as the international community. So please sit back and enjoy the video.
اسمي إلهام طلال عامر، أردنيتي الجنسية، عمري 24 سنة، واحدة من قياديات عمان بمنظمة كير، أخصائية اجتماعية. تعلمت من منظمة كير كتير أشياء واستفدت منهم كتير أشياء. من الأشياء اللي أنا استفدتها أول شيء إنهم عرفوني على سيدات رائعات قياديات بالفترة عندهم حب التغيير، بالإضافة إنه أعطونا عدة محاضرات كتير حلوة أغلبها عن العنف ضد المرأة، وكمان إحنا أعطينا محاضرات عن العنف ضد المرأة، أخذت معاهم دورات لهلأ كتير حلوة، من ضمنها كيف إنه نجمع حشد وكمان كيف إنه نتعامل مع العنف ضد المرأة. ظروفي المعيشية مثل باقي الناس بالبلد متوسط الحال، مع العلم إنه كورونا دهورت أغلب الأوضاع بالبلد وبالعالم كله. هلأ من التحديات اللي أنا واجهتها في الأردن كبنت وكشابة، واجهت كتير تحديات. أول شيء ثقافة الناس الغلط عن الأنثى، بالإضافة للممنوعات الكتير اللي إحنا بنعاني منها، مثلا إنه شغل، بروح بقدم له شغل وقولوا لي مثلا أنت ساكنة بعيد. طب يعني أنا قادرة أجي، إنه أنتوا وين حجتكم إني أنا ساكنة بعيد مثلا؟ أو بحطوا كتير معيقات، أحيانا بحطوا مثلا وقت خبرة، فترة خبرة معينة، بتروح بتاخذ الخبرة هاي وبترجع بحكوا لك لا أنت معك خبرة، بنخاف تطلب مصاري زيادة بالراتب، بالإضافة للرواتب الكتير قليلة. حتى كمان إنه كشباب، إنه ذكر مثلا بده مصاري يأسس حاله كذا، الرواتب غير كافية. وإحنا كشباب كتير بنحب إنه نطلع مبادرات، نساعد الناس المحتاجة، الفئات المحتاجة، بس أحيانا إنه عدم توافر شغل بخلينا إنه واقفين، إنه ما بنقدر نطلع، لأنه الطلعة مثلا محتاجة فلوس، أو مثلا بكون شغلنا كتير طويل ما فيش وقت، لأنه كتير عم بيستغلوا، بعطونا مثلا أوقات طويلة للشغل، هذا إذا لقينا شغل بعطونا رواتب أقل من الحد الأدنى للأجور، فعم بيستغلوا حاجة الشباب إنه بخلوهم يشتغلوا وقت طويل، مثلا رواتب كتير قليلة. بالإضافة للمعيقات الثانية كتير، مثلا إنه حتى المناصب بالبلد كل إشي بده خبرة طويلة. طب أحيانا اللي عنده خبرة طويلة ما بكون دينامي مثل الشاب، أحيانا مثلا ما بكون عنده التفكير المناسب، بس إنه لا، يعني في كتير بالبلد بحطوا الشخص الغير مناسب بالمكان المناسب، يعني إنه ما بحطوا كل واحد مكانه. ف إنه لازم إنه يرجعوا يراجعوا هاي الأمور. طبعا وأكيد عانينا من أشياء تانية كتير، كبنات مثلا في مجتمع عربي، مثل القيود الكتير اللي محيطة فينا، التنمر، المفترسين اللي دائما بيكون بدهم أشياء غلط من البنات، الوسط والمحسوبيات وغيرها من الأشياء. الأشياء الحلوة اللي أنا شفتها بالبلد ويعني مريت فيها، كتير ناس ساعدوني، في لسه خير، في مواقع منيحة، في أشياء حلوة مرينا، باقي منظمات العالم ولباقي الناس بشكل عام كمان، مش بس المنظمات ولا صانعي القرار، إنه لازم تدرسوا أكتر عن المحيط، لازم إنه تتعاملوا أكتر مع المحيط، ما تحكوا إنه هاي مشكلة وخلص بتنحل وبتمشي، لأنه المشكلة بتصير سنتين ثلاث، وغير هيك في كتير مشاكل تانية إحنا مش عارفين عنها، لأنه هي ما صارت مثلا قضية رأي عام. مش كل شيء بصير قضية رأي عام، في كتير ناس بيخافوا يحكوا، في كتير ناس بيخافوا يطلعوا. لازم إنه نتعامل مع هاي الأمور أكتر، لازم إنه يكون في دور أكبر للشباب، تحطوا الشباب في المقام الأول دائما، لأنه هم اللي بإيديهم تغيير المستقبل، تغيير الواقع اللي إحنا فيه. لازم كمان إنه يكون في رقابة دائمة على كل شيء، مو بس على مثلا أشياء محددة، لازم الرقابة تكون بكل مكان حتى يكون دائما الشخص المناسب في المكان المناسب.
آدم أحمد، العمر 35 سنة، أعيش في الأردن، أعزب، متطوع في منظمة كير العالمية. حدي إنه ما في شغل أو تصاريح عمل غير عندنا موضوع اللي هو التدريب مثلا، يعني برامج. إحنا ما مخصصين للجنسيات الأخرى زي السوري، اليمني أو الصومالي، السوداني. ما يعني ما في مجالات انه هم او يخدموا اللاجئين من الجنسيات الاخرى بتصاريح العمل او التدريب. طالب المنظمات الاخرى، المنظمات يعني بمساعده اللاجئين من الجنسيات الاخرى، يعني كمساعدات على دمج اللاجئين في المجتمع، اللي هو مثلا تصاريح العمل، التدريب المهني او البرامج الاخرى اللي هي بتخلي يعني تعطيه حافز انه يقدر يعيش في المنطقه اللي هو فيها.
مساء الخير عمو.
اهلا وسهلا.
اهلا وسهلا فيك.
بارك الله فيك.
حابين ان نتعرف على اسمك، جنسيتك والعمر، وكم إلك في الأردن؟
أنا اسمي اللاجئ عيسى حسن شحادة، عمري 56 سنة، سوري الجنسية. دخلت الأردن في عام بتاريخ 19/5/2014.
أنت هون موجود مع عائلتك أم وحدك؟
لا، مع عائلتي.
كم عدد أفراد هون؟
دخلنا على الأردن عدد أفرادنا 6، لكن بقينا 3. اللي يتزوج وهي حال الدنيا.
سنة الحياة. ممكن تعطينا نبذة مختصرة عن وضعك المعيشي، حياتك المعيشية؟
والله وانا حياتنا المعيشيه شويه يعني فيها صعوبه من الناحيه الاقتصاديه. يعني المعونات المقدمه الغذائيه اكثر شيء لا تكفي للناس، يعني غير كافيه للكل مش بس إلي. فاحنا بنعاني من شيء اقتصادي يعني بحت.
طيب حضرتك بتعمل حاليا، بتشتغل؟
للاسف لا، بدون عمل.
ايش بتعمل؟ يعني
انا هنا بشتغل ناشط بالمجتمع المحلي، ممثل للمجتمع المحلي، وبقضي أكثر وقتي بهذا العمل اللي هو أصلا بدون أجر يعني طبعا. نعم.
طيب هل ممكن انك تذكري لنا مواقف مثلا تحديات صارت معك بالأردن، مواقف إيجابية حصلت لك خلال هذه الفترة من السنين؟
والله أنا بعتبر المواقف الإيجابية اللي حصلت إلي ولكل اللاجئين اللي دخلوا على البلد الكريم اللي هي العيش بالأمن وأمان واستقرار، والحمد لله عايشين بكرامة وبعزة بهالبلد الطيب.
طيب ما هي طموحاتك؟ يعني ايش بتأمل للمستقبل؟
والله أغلب الطموحات إنه أكون عايش، أظل مستمر بهالأمن والأمان وهالاستقرار اللي إحنا عايشين فيه، وطموحاتنا إنه تتحسن حالتنا المعيشية بشكل كامل.
طيب ما هي رسالتك للمنظمات في المجتمع الدولي كممثل مجتمعي هون في المخيم الأزرق؟ شو الرسالة اللي حاب توصلها لأصحاب القرار؟ خلينا نحكي.
والله الرسالة اللي هي أول شغلة يعني إنه ما ينسوا اللاجئين السوريين إن كان بالأردن أو غير بالأردن، لأنه وين ما كانوا هم بحاجة للرعاية والاهتمام، وإذا ما تم رعاية واهتمام بشكل صحيح من قبل المجتمع الدولي فراح نكون مأساة. فرسالتي للمجتمع الدولي وللمنظمات بأنه يحاولوا يزودون المساعدات اللي بتيجي والدعم اللي بيجي، اما بشكل مباشر او بشكل غير مباشر من خلال المنظمات اللي هي قائمه وعلى تامين احتياجاتنا بهالمخيم وغير المخيم، او اذا لم يمكن يعني البلد المضيف اللي احنا فيه يعني يقدموا المساعدات لهالبلد المضيف حتى يقدر يحتوينا كأيادي عامله كمهن ككذا. فهنا بتصير العملية مشتركة، لأنه في سبق يعني اجت مكرمة من الأردن اللي هي تصاريح العمل وساهمت لحد كبير أنه تحسن من وضع المعيشة كلاجئين داخل الأردن.
شكرا لكم، أهلا وسهلا.
حياكم الله، أهلا وسهلا.
شكرا كثير هذا الفيديو القيم جدا. أخت إلهام، أخ عيسى، أخ آدم، شكرا لكم لكلمتكم ولتجاربكم وإنه شاركتونا فيها. يعني أنتم اللي بتحفزونا إنه نضل نكمل مسيرتنا إيد بإيد، وإن شاء الله صانعي القرار والمنظمات اللي عم بيستمعوا لكم اليوم رح يعني يشتغلوا حتى أكثر وبجهد أفضل يعني إن شاء الله على دعم ومساعدة الجميع لدعم وتمكين أنفسهم. فشكرا كثير لكم. يعني إحنا ما بنكون هون موجودين بهذا الاجتماع لولا أنتم موجودين ولولا أنتم جنبنا بهاي المسيرة الإنسانية. I'm going to now open the floor for our question and answer session. We have two very interesting and strategic questions. The first one, Ammar or Your Excellency, please feel free to take it up. The question is regarding the representation of refugees in decision-making at different levels, what is being done? So I don't know, Your Excellency or Ammar, if you would like to take up this question. Your Excellency, the floor is yours.
Yes, perhaps I can invite my head of humanitarian operations, Rebecca Valentine, to address that specific. I'm sure she's in some ways better equipped to talk to the detail than I am. Thank you.
Okay, I'm not sure if Rebecca is online with us at the moment, Your Excellency. But I think we can. I think Ammar can cover that, and then we can send a message from Rebecca to all our participants. Ammar, please go ahead.
Yes, I think Rebecca is going to come in. So if I can say a couple of things on this question while we figure out the audio. I think refugee representation is key for us to ensure at different levels and to look at them not only as part of the decision making or making sure that we have the feedback and channels of communication with the refugee community, but also to recognize that, especially in this kind of prolonged crisis setting, that there is a lot of capacity and competency amongst the refugees themselves, where they can be part of the design of the programming and the implementation of a lot of the programming that we are developing as civil society on different levels. So there are different ways that we can achieve both. I think on the first level of feedback and decision making, there are different models that have been put in place in terms of community committees, leadership councils, community representatives that facilitate that kind of communication and feedback from the community to various stakeholders in the country. I think there is room to improve on that and to take it to a next level in terms of other modalities and more formal structures and approaches. And on the second level of including refugees in the actual design and implementation of programs, I think we need to look more at ways that we can build on a lot of the volunteering opportunities that have been provided to refugees and to take them to the next level in terms of allowing them to acquire and deploy skills that they've acquired through the work and through the different trainings and programs provided by civil society. And there are a lot of inspiring stories of that that we see in the field.
Okay, thank you very much, Ammar. Rebecca Valentine is the Deputy Head of Mission of the Australian Embassy in Jordan. Rebecca, please, the floor is yours.
Thank you so much, Nahla. And thank you, Ambassador and Ammar, for inviting me to contribute. I guess from the Australian side, we try and approach sort of meaningful participation in a number of ways. Certainly when we ourselves are able to go out and speak with members of the community here, refugees, Jordanians, we make it a part of our policy here in Jordan and elsewhere to make sure that once we've sort of heard and understood people's experiences, that we have mechanisms ourselves in place to feed back later on how we've used that information and how we're using it to influence the programming and the policy decisions that we as the Australian government are making. And I guess in terms of the way we engage with our humanitarian and development partners, it's something that we kind of have very regular conversations with our partners about the systems and the approaches that they have in place to engage refugees and vulnerable populations in their own processes, in their planning, in evaluations and monitoring, and making sure that all of the designs and everything that happens is as participatory as possible. So I guess they're the two elements that we look at, but I hope that's useful. Thank you.
Yes, very, very useful. Thank you very much. So thank you so much, Rebecca and Your Excellency. It's always good to get a donor perspective on these issues and the fact that refugees are indeed included at various levels of the process. Our second question is, and I think Ammar, maybe you can answer that one, please. What recommendations do you have to donors in respect to implementing the one refugee approach across various program priorities?
And here there are two levels that we need to look at. For the donors, I think it's being more open to the inclusion of non-Syrian refugees and more open to having services provided and based on vulnerability rather than based on origin. But there is also a second level that relates to the government of Jordan's plans and response, and where there can be more openness in the policy framework and regulations to allow for more access for non-Syrian refugees, particularly to livelihood opportunities and other programs where there might be more restrictions that are coming from the government's rules and regulations rather than from the donors. So in that sense, I think the donors can do well to maintain the positive messaging to the government of Jordan about the one refugee approach and the importance of adopting it. And I know that many of the donors are channeling these messages to their counterparts.
Okay, thank you very much, Ammar. And for our final question, what role has technology played in terms of the organization's different responses to the COVID pandemic in Jordan, and how has CARE International addressed this issue?
So I think technology has been an opportunity for CARE and many of the other international organizations to be able to use technology to do virtual delivery of services, including case management, including outreach, to be able to build on the use of Zoom and other technologies and the wide penetration of internet in the country in order to be able to get more work done, particularly during the lockdown. And we're now building on that, developing more tools that can be used by other organizations as well in order to deliver services at a reduced cost and often in a way that is more convenient for program participants, particularly where we're able to offer focus group discussions or peer support sessions at more convenient times for program participants who have work or family obligations and are more available in evening sessions, for example. So we're finding that there are opportunities in the use of technology that started initially as a response to the lockdowns, but now is an area that we're able to build on strategically so that we can address and overcome more of the needs that the community is facing.
Okay, great. Thank you very much, Ammar. Thank you very much, Your Excellency and Rebecca. And now, Ammar, it's back to you again for closing remarks. Thank you.
Thanks, Nahla. Maybe first, I want to see if His Excellency has any
yes,
closing comments or any other issues to share.
Thank you. Making sure that my mute button is off. We have come a long way, haven't we, with virtual meetings and Zoom technology. And I think it just shows the dedication, the resilience of your organization in terms of how you've kept up the tempo of your operations and engagement over the period. This has been an extraordinarily valuable and instructive hour for me. It's wonderful for me to be hearing on the detail of developments and all the good work that's been done. And I think with collective minds and approaches, I have regular discussions with the government here, with donor partners and UN and other agencies. And certainly it is a collective effort and we all have something to bring to the table. So thank you again for this opportunity today.
Thank you, Your Excellency. It's indeed been a great honor for us and for all those who've attended today from the different NGOs, partners, governments, and CARE staff themselves. So we've all been very excited to have you with us. Thank you so much. And now I will give the floor to Ammar for closing remarks. Ammar, please.
Thanks, Nahla, and thanks, Your Excellency. And really, I want to reiterate the thanks for the Australian government for all the support for CARE's different programming, and also to really thank the other donors who support CARE's work, including and not limited to the annual assessment, UNHCR, NORAD, the BPRM, the Australian government and the Austrian government, Germany, H&M and Novo Nordisk foundations, as well as others. Really grateful for the collaborative spirit, the commitment and support that is allowing us to continue to design programs that benefit Jordan and everyone in Jordan in the best way possible, and to take on the current and coming challenges with determination and conviction. The times ahead are going to be difficult, and there's a lot that we'll be able to do together, and to be able to leverage what we are learning from these kinds of needs assessments that are channeling information from the ground up, build on them, work together, and do the best that we can for the people we're here to serve. Thank you.
Thank you. Thank you, everybody.